Which of the following medications is known to cause orange-colored urine? Phenazopyridine, pyridium. You are ordered to give digoxin. Your patient's vital signs are as follows: blood pressure 130/75, temp 97.9 oral, HR 52, O2 sat 100% room air. What should you do next? Hold digoxin and call the provider. Normal saline, NS, is the solution of choice over D5W when preparing to administer a blood transfusion because normal saline is an isotonic solution and prevents cell hemolysis. Patient is to receive 5 mg/kg of medication. Patient weighs 80 kg. How much would you administer? 400 mg. Your patient taking digoxin, lanoxin, has an AM potassium level of 3.0. This level may increase risk of digoxin toxicity. The patient is diagnosed with multiple myeloma. The physician has ordered cyclophosphamide, Cytoxan, which instruction should be given to the patient. Increase daily water intake. Which of the following medications will crystallize when mixed with D5NS? Phenytoin, Dilantin. Which of the following medications should be questioned by the nurse, if ordered by the provider to treat a patient's complaint of nausea and vomiting? Famotidine, Pepcid. Your patient has an epidural infusing hydromorphone with bupivacaine at 6 ml per hour continuously. The patient's blood pressure at the beginning of your shift was 92/58 with a heart rate of 68. You noticed the patient's blood pressures have been around 130/70. What should you do first? Check infusion rate to confirm 6 ml per hour, then notify anesthesia provider, the dosage of which drug must be tapered off slowly to prevent acute adrenal insufficiency. Prednisone, Deltasone. When teaching a new nurse on how to administer 4-push furosemide, Lasix, you emphasize that it should be given over 2 minutes to avoid tinnitus. A nurse is caring for a patient with hyperparathyroidism and notes that the patient's serum calcium level is 13 mg/dl. Which medication should the nurse prepare to administer as prescribed to the patient? Calcitonin, Miacalcin. A patient has a prescription to take guaifenesin, Mucinex, every 4 hours, as needed. The nurse determines that the patient understands the most effective use of the medication if the patient states that he or she will take the medication with a full glass of water. Acetylsalicylic acid, aspirin, has which of the following pharmacological effects? Anti-inflammatory, antipyretic, decrease platelet aggregation. Your patient is to receive 2G vancomycin over 2 hours. The medication comes in from the pharmacy as 2G vancomycin in 250 ml normal saline. At what rate will the 4 medication run? 125 ml per hour. Sildenafil, Viagra, is prescribed to treat a patient with erectile dysfunction. A nurse reviews the patient's medical record and would question the prescription if which of the following is noted in the history: use of nitroglycerin, while delivering the lunch tray of a patient who is taking warfarin, Comaid. The nurse notices diversity of food items. Which of the following foods would be a concern? Spinach. Your patient is receiving vancomycin, vancomycin 500 mg for every 12 hours. As a nurse, you understand that the primary rationale for monitoring serum levels of vancomycin is that it can cause nephrotoxicity. Convert 1.2 mg to micrograms 1200 mcg. You are caring for a patient with diabetes. Humalog insulin is ordered via sliding scale AC and HS. When is the best time to administer Humalog insulin? 15 minutes before meal arrives. A provider orders 1 liter of NS to be infused over 4 hours. At what rate would you set the 4 pump? 250 ml per hour. Wrong. Which medication is used to treat iron toxicity? A. Digoxin immune fab, Digibind. B. Naloxone, Narcan. C. Mefetin, vitamin K. D. Wrong. Difroxamine, Digibind. Your patient presents with CHF and has a potassium level of 5.8. Which diuretic do you anticipate being ordered by the provider? Bumetanide, Bumex. Your patient is on a morphine PCA after a recent exploratory surgery. While doing your rounds, you notice that your patient is slumped over, unresponsive, with delayed and slow respirations. You suspect narcotic overdose. Which reversal medication would you administer? Naloxone, Narcan. A patient's capillary blood glucose reading is 33 mg/dl. Which of the following medications will the nurse administer if the patient is unable to tolerate PO? Dextrose 50% for push. When a patient has pernicious anemia, the nurse would expect to give them vitamin B12. Wrong. Which of the following anticoagulant is most commonly administered for DVT prophylaxis in a patient who has undergone a hip replacement? A. Wrong. Heparin B, enoxaparin C, aspirin D, warfarin. Which of the following is considered an antiplatelet medication? Clopidogrel, Plavix, sildenafil. Viagra is prescribed to treat a patient with erectile dysfunction. A nurse reviews the patient's medical record and would question the prescription of which of the following is noted in the history. Use of nitroglycerin. Which of the following medications should be held today considering that your patient received 4 contract 2 hours ago for a CORT scan? Metformin, glucophage. The patient is diagnosed with multiple myeloma. The physician has ordered cyclophosphamide, Cytoxan. Which instruction should be given to the patient? Increase daily water intake. Your patient, a type 1 diabetic with a history of schizophrenia, is exhibiting signs and symptoms of tardive dyskinesia. Which of the following long-term medications is more likely the etiology of the problem? Chlorpromazine, thorazine. When caring for a patient with a central line who is receiving TPN, what is the most important action on the part of the nurse to prevent CLABSI? Perform correct sterile technique for dressing change at the CVC site. Red man syndrome may occur during the administration of vancomycin, vancomycin, primarily due to an increase in histamine production. Your patient has been diagnosed with chronic CHF and will be taking Lasix 80 mg PO twice a day. When teaching about high potassium foods in the diet, which group of foods would you recommend to the patient? Bananas, spinach, raisins,